long-term care planning, we're going to identify various factors that affect long-term caring, like budgeting, like your family size, and other caregiver factors. We're going to learn how to make informed decisions, right? I'm going to teach you guys some tips and tricks on how to make sure that we're making the correct decision for our long-term care planning. And we're also going to learn how SCRC can help you in your journey. Next slide, please. Let's talk about some life expectancy statistics. So caring for a loved one can often seem like a roller coaster, right? And it has its ups and it has its downs. The most thing that caregivers talk about is rewarding. So why can that be? So life expectancy has increased as time goes. Individuals all over the country are living much longer. Now we have individuals that are living past 100 years old, and it's no longer a big deal, right? We've heard about, oh, this person lived over 100, oh, this other person lived over 100, and it's no longer a big deal. Back in the 1800s or 1700s, it used to be a huge deal. So now that people are living over 100 years old, the need for family caregivers will only continue to grow, and we must be better. We must be make a better job to prepare for this. We also know that the age that is 65 or years of older, it's expected to double to 70 or 80 million people by the year 2030. So that's very soon. More than 50 million people provide care for the chronically ill and disabled and frail or family members, right? So 60% of those caregivers are also going to be women with no training or simply just a family caregiver that are not getting paid. 78% of adults in the United States who receive long-term care usually receive it from unpaid family friends or family members or simply just the next relative. Next slide, please. Let's talk more statistics. Living longer is certainly good news, of course, but only if we have a financial strategy that accounts for a retirement that could last 30 years or more or includes a solution to a potential long-term care needs. So general increases in life expectancy, right? So between 2012 and 2050, it's a long gap, but the United States will experience a considerable growth in older population. We can see it in the graph right here. It's a really big slope that we can see in growth in population. So by the year 2050, the population age 65 and over is projected to almost double from 43.1 in 2012 to 86.2 million people that are 65 years or older. So the baby boomer are largely responsible for this increase in the older population as they began turning 65 by 2011, and by 2050, the surviving baby movers will be over the age of 85. Why is this happening? Why are we living so long? Well, it's a good thing. So public health historians and epidemiologists, they calculate that the majority of life expectancy increase during the last approximately 200 years resulted from the control of infectious disease. We don't get pandemics as often, right? Kind of ironic, but we just had one. We also have more abundant and safer foods, right? It's easier to find food, safe food to eat, better sanitary conditions, and other non-medical social improvements. In 1950, the expectancy for a man was 67 years old, sorry, and 72 for a woman. So 67 was the longest that on average a man lived. And today, according to the Social Security Administration and the censuses that they make, a 65-year-old person can live to an additional 19 to 21 years. So that is 86, 87 years old on average. What's more, the Social Security Administration says that a quarter of 65 years will live to the age of 90, and 1 in 10 people will live beyond the age of 95, which is incredible. We're living longer than we ever did before. But now that we've acknowledged that Americans are living longer than ever, we need to talk about the assumptions associated with the cost of care. So we're going to direct your attention to the graph to the left. A survey conducted by Gensworth in 2018 found that Americans significantly underestimated the cost of home care living by almost 50%. So 4 out of 5 adults underestimated the cost associated with specifically with home healthcare in general. Despite home care being most popular care options, nearly 1/3 of Americans incorrectly estimated the cost. They think it's about 5 to 10,000 a year, when in reality it could be 50 to way more money a year. So in the graph we have different types of long-term care. We have nursing home, which is a private type of long-term care, could be up to $100,000 a year. A nursing in a semi-private facility could be up to $89,000 a year. A home health aide, someone to have to be in your house helping you having that long-term care conditions, could be up to $50,000 a year. A homemaker services, which is similar to home health aid, it could be up to 48,000 a year. Assisted living facility, which is what we hear of the most, takes up to 48,000 a year. An adult day health center, which is only a couple hours a day, right? It's only 8 to 9 hours a day. It's a day health center. It's only there for the hours while one works. It could be up to $18,000 a year. So these costs are extremely inflated and definitely have not been the same that people think. People think it could be only 5 to 10,000 a year, when in reality we have $100,000 a year, right? Completely off the scales. It's really, really expensive to have a long-term care. Let's move on to the next slide. So let's take a step back and really understand what is long-term care and what it includes in it. So these services help people live independently and safely as possible when they can no longer perform their everyday activities on their own, or also called ADLs, activities of daily living. With so many misconceptions and assumptions surrounding the long-term care, it is important to be clear on what we mean by long-term care. LTC, long-term care, encompasses a variety of services that include the need for both medical and non-medical assistance. Typically, LTC is associated with any personal or medical assistance an individuals may need to accomplish their activities. These activities include things like bathing, dressing, contingents and toileting, basically going to the restroom, eating, transferring or moving from a sitting position to a standing position from a laying down position. While thinking of long-term care, people think of nursing homes and skilled nursing facilities. However, the majority of long-term services are actually just provided at home, and in adult day facilities, and assisted facilities, or simply by a family member, which is most of the cases. Long-term care also includes a community services such as meals, adult daycare, and transportation services. These services may be provided for free, or for a fee, depending on what long-term care plan you have going on. People often need long-term care when they have a serious and ongoing health condition or disability. The need for LTC care may arise suddenly, such as having a heart attack or a stroke, or most often, however, it develops gradually uh, as people get older and frailer and as an illness or disability gets worse, which is most cases for the regular family caregiver. Let's go to the next slide. So we need to keep our goals in mind, right? So what does LTC really encompass? It really encompasses a wider variety of medical, social, and personal and supportive services and specialized housing services needed by individuals who have lost some capacity for self-care because of a chronic illness or disabling condition, right? That's simply the definition. It's a long-term care differs from any other types of healthcare in that the goal of long-term is not to cure an illness, right? But we want to make sure that an individual can maintain an optimal level of functioning. They can remain in society, they can remain interacting with their family and their friends while still being able to operate some very simple level of functioning. Next slide, please. So caregiving and long-term, this is where we step in, right? So long-term care is provided in different places by different caregivers depending on the person's need. Every case is going to be different. And it can be given to a facility such as a nursing home or in the community, for example, an adult daycare center. So most long-term, as I already said, is done by an unpaid family caregiver, and it's difficult to predict how much and what type of long-term care your family members will need, right? And also, most importantly, how will you pay for it? Other things that long-term care might have, it's called home-based long-term care services. Home-based, as in the name, will be provided at home, right in your own comfort of your own house. Most long-term care is provided either in the home or in those services. They involve things like personal care, such as with bathing, dressing, and taking medications, right? Supervision to make sure that the person is safe and then not doing things that they shouldn't be doing, especially in cases with Alzheimer's and dementia. And most of these services are done by, as I said, family members. Let's go to the next slide. The ideal situation. What is the perfect plan? In a perfect world, what's going on, right? So in the ideal situation is that the parents have already made plans. The person who will need care have already made plans for themselves. Family discuss already the decisions. An advanced healthcare directive have been in place, and the agents that are managing those cases have been notified that they're going to need long-term care. Life insurance was purchased, long-term care is planned and purchased, and the adult children have done the same, and they're all in the same plan. That's the ideal situation, right? Things have already been in place, they have been preparation, and there has been steps to take in. Unfortunately, that's not the case. Next slide. The reality is that most times we are ill-equipped. We do not have a lot of preparation done in place. There's a lot of hesitation to execute wishes. There's a lot of emotions that come through, emotions of guilt, emotions of being alone, right? Because we don't want to put our loved ones in a care facility. It feels like we're abandoning them, right? There's a lot of hesitation, and this could provide a lot of stress, such as emotional stress, right? And financial stress. As we said, it could be really expensive, and also physical stress if you're the one who's going to be providing the long-term care. At the same time, we have lack of support. Sorry, lack of support. We might not have all the support of the family, and everyone might not be on board, right? You might want to put your loved one in a home care facility because you're the one providing the care, and you're tired, and you want to be able to have schedule your own time, and you want to might put your loved one in a home care facility, but someone else from the family might not want to do that. So there's definitely going to be a lot of lack of support and hard decisions to come through. And at the end, also there's going to be a lot of frustration. You might not be happy with the things that you did. You might not be happy that you didn't plan ahead. So there's going to be a lot of a lot of mess, a lot of feelings, a lot of hesitation, and you're going to be ill-equipped. So what can we do about it? Next slide, please. So the first thing that we want to do is we want to determine the level of care, right? So figure out how your fits need, what needs you need to really make sure that you're approaching. So you're gonna check your family, your loved one, and develop a level of care. Are they gonna need really intensive care? Do they have mobility issues? Do they have toileting issues? Do they have feeding issues? Right? You wanna make sure that you know what type of care they're gonna need. Where will the parent live? How will the primary who will be the primary caregiver? Are there any specifics to the care team involved? Who will help coordinate the care plan, right? A lot of these questions that need to be done. So making the decisions to move the person that you've been caring for to a home care facility is one of the most difficult decisions you will have to make. However, it will also be one that is necessary, both for your well-being and for the person that you're caring for. Being well prepared and creating a plan is going to make this decision less stressful. Often, when a vacancy becomes available in a long-term home, because not all long-term care facilities have spaces. A lot of the times they're full, and you have to wait for a vacancy to put your loved one there. So when there's gonna be a vacancy available, you're gonna need to make a decision quick. So for that same sense, you want to make sure that you are prepared and you've already made a decision. It is important, therefore, to familiarize yourself with the long-term care homes in your area and ask questions about the services, policies, and costs beforehand. This will make you make a best decision and not a rush decision. So definitely make sure that you are aware of the facilities around your city and around your county. Next slide, please. Saving myths. Let's talk money. So a lot of people think that they will be able to cover long-term care costs right out of pocket. However, as you've seen today, long-term care can cause people to draw down to their savings as much faster than anticipated. We said that a yearly cost for a in-home professional facility could be up to $100,000 annually. Not everyone has that type of cash, right? So you've worked hard to prepare for retirement, and likely you've spoken to a financial professional about a strategy, hopefully. And if you plan for LTC hasn't been included in your retirement, your strategy, your monetary strategy is a risk. So accessing funds to pay your insurance and long-term costs can be taxable events. So reaching out for that money can be taxed and further reducing your retirement funds. Of course, there is more added stress that comes with trying to figure out how to pay for your medical expenses while being in a vulnerable position. It is also important to consider how an event like this would impact a healthy spouse, if your retirement funds are being diverted to medical expenses, and what is the remaining spouse going to be to live on, or what are your kids going to be living on with, right? What is all that money going to be spent on? So this is why it's essential to have a monetary and a financial plan ahead. So what are financial plans, and what is out there? What type of coverage that exists? Next slide, please. This is where we do some myth busting. Many people think that health insurance, Medicare, and Medicaid will take care of their long term care needs. However, this is not the case. Medicare, let's start there. Medicare does not provide long term care coverage. In fact, Medicare typically only covers a portion of skilled nursing facilities costing for only up to 100 days, no more than that, and a qualifying hospitalization must occur first to activate this benefit. So you don't even have a nursing facility available until you have a hospitalization first. It's a need before a want, right? It is only provided limited amount of resources and coverage for certain types of home care, not all types of home care either. Moving on to Medicaid. Medicaid only provides a long-term care benefits to people with limited income and assets. If you're considering this option, you will need to spend down your assets, including real estate and annual income, for position yourself in a way to determine your needs for governmental support. And there are other drawbacks of using Medicare as well. There are limits on the amount of assets our spouse can own and the amount of income you can earn. When assets are spent down, it creates tax exposure. So Medicaid can only support you if your income is below their set average. I believe it was below 12,000 or 13,000 a year, along those lines. It's really, really low. So if you make more than 15, let's say for approximately 15,000 a year, you will not be able to have Medicaid. So you would have to spend down on your assets in order to get Medicaid, which is not recommendable for anybody. And now the last one is employer sponsored plans or private health insurance, PPO, right? If we look for employer sponsored plans or PPO, private health insurances, most employer sponsored or private health insurance options cover the same kind of limited resources as Medicare, Medicaid, and Medicare. If they offer long-term care services, it is typically only for skilled, short-term, and medically necessary care. It is not a long-term care plan. They will only offer it specifically for less than 100 days or less than a year. So it's not there forever. So that's why these type of insurances and coverages are not recommended for long-term care. Next slide, please. Let's talk about long-term care insurances, right? So we have a graph here, Medicare versus long-term care insurance. So I want to briefly discuss the traditional long-term care insurance, which is what we would recommend to plan along. So traditional long-term care insurance is designed to cover long-term care services, right? Including personal and custodial care in a variety of settings, such as your home, a community organization, or other private facilities. Advertise is one of the most comprehensive resources available for LTC, and they're also the most expensive. Additionally, traditional long-term care policies have been plagued with premiums increases and steaming with raising cost of healthcare affecting our nation, and these policy premiums will likely continue to raise, so it's best to plan ahead. You have to medically qualify for coverage, and if you can no longer afford the policy and cancel, you will lose all of the money that you put into it. So this is a high risk, high reward situation. Lastly, some people dislike traditional long-term care coverage because of the use it or lose it mentality, right? So if you use it, great, it's there for you. But if you lose it, then you would lose all the money. If you never had this type of protection, it's great news because you don't need to get paid your premiums back in return. Since insurance have come to realize that this type of standalone long-term care coverage is very unattractive to many people, they have developed other options using annuity and life insurance to assist the cost of long-term care. So life insurance and other long-term care insurances might be beneficial for you. I know these slides contain a lot of information and can be very overwhelming, but these decisions don't have to be made alone, right? Southern Caregiver Resource Center is here for you, and we have professionals that can make you do all these really hard to come decisions. Let's move on to the next slide and talk about Southern Caregiver Resource Center. So as you can see in the screen, we offer support services to low cost or free to family caregivers in English and in Spanish. So we have things like education and training, which is what I do, right? I go to the community and make sure that the community is aware of any caregiver resources that we can provide in other educational material, things like in Alzheimer's and dementia and other long-term care conditions. We have short-term counseling, support groups, specialized information, a library full of resources is in our offices with a lot of information available to you. We have the Alzheimer's Care Program, which I'll talk about in just a second, case management, and employer resources, and legal and financial consultation. The case management and the financial consultation is where we would love to step in and help you do those really difficult long-term care decisions for your family loved ones. We would have trained master level clinicians that will be able to help you out in those situations. The next slide, please. This is our LTC, I'm sorry, our TLC, Thrive, Learn, and Connect program, or our TLC program provides strategies to cope with stress. It gives behavioral tools to manage your mood and take control of positive activities. We want to make sure that you're coping with frustration and help you how to address isolation, also by experience by caregivers. Caregiving can be a really, really stressful and can have a lot of caregiver burnout, especially in caregivers with Alzheimer's and dementia, which is what this program specifically talks about. So these are free classes that you're able to just sign in simply by contacting our organization. We'll have the phone numbers at the end of the slides. So also next slide, please. The best way to reach out to us is via our website and www.caregivercenter.org. And you can find a lot of fun things in the website, like our caregiver corner, which you can watch quick tip videos on various aspects of being a caregiver. Our podcasts, which they're monthly podcasts. You can listen to them while you're driving or simply just while you have some time off to learn various caregiving topics. We have the family caregiver classes that you can sign up for in our website, and the digital newsletter so you can stay up to date with all the news SERC has to offer. The next slide, please. You can also follow us on our social network at Facebook, Instagram. We have LinkedIn and YouTube, where this is where you should be watching it right now and where most of our recordings are uploaded to. So definitely follow us in our Facebook and our Instagram, so social network. And last but not least, next slide, we'll have our big www.caregivercenter.org, or you could simply type caregiver at simply type www.caregivercenter.org. Sorry about that. And our phone number is 858-268-4432. Thank you so much for signing in today and to our live stream. I hope you have a wonderful rest of your day and a happy Thanksgiving next week. Bye bye now.